Wonderful. Well, thank you to everyone who's joining online and to this full house in person, which is really exciting to have a hybrid talk today with dear friend visiting professor today. Really excited to be able to introduce him. My name is Emmy Betts. I'm the Deputy Director of the Injury Center with Ashley Brooks Russell, and I'm the Director of the Firearm Injury Prevention Initiative here on campus. Let me first, before I introduce Ali, mention that we hope you will join our next seminar as well, which is going to be Tuesday, March 14th at noon on child passenger safety. So very different topic, also important, and we hope you can make it. So for today, though, we're really thrilled to have in person Dr. Ali Rowhani-Rahbar from the University of Washington. He is the Bartley Dodd Professor for the Study and Prevention of Violence. He's also a professor of epidemiology and has adjunct appointments in pediatrics, public policy, and governance. He evaluates community-based interventions, social programs, and public policies for their impact on multiple forms of violence, with a particular emphasis on preventing firearm-related harm. His research has been funded by the CDC, the NIH, the Department of Justice, Arnold Ventures, the National Collaborative on Gun Violence Research, Fund for a Safer Future, State of Washington, and the City of Seattle. And we are really excited to have him visiting in person. And I will turn it over to him today for his talk. Thank you.
Great. Thank you very much, Amy, for that kind introduction. Please let me know if you can't hear my voice or you have any technical difficulties. I think the way it's going to work is I'm just going to say the next slide. So maybe we can go to the next slide. Thank you. So as I was thinking about, the content of this talk, this seminar, and it's a wonderful opportunity to talk to you all about a decade of research related to the integration of healthcare and criminal legal data. Really, I want to give your opinion and thoughts on this line of research. I want to have enough time by the end of this seminar to brainstorm, hear from you, and really use this opportunity to learn together and think about potential future collaborations. As I was thinking about what to talk about and what to not talk about, let me just tell you first what this talk is not about. Because this is such a nationally recognized hub for firearm suicide research, I decided to not talk about firearm suicide today. Emmy and Joe, and I think I know everybody in this room. We have been working on a variety of different types of projects on firearm suicide and self-inflicted harm, and I know there are lots of efforts going on related to that line of work. So I'm not going to talk about it today. The other thing that this talk is not about is this is not an in-depth discussion about any substantive or methodologic issue related to any of the things I'm going to talk about. We won't have time to talk about any of those in detail. Rather, this is really just a very broad coverage of about, as I said, a decade of research. And so I will show you lots of different research articles and different projects that have been centered on this topic, but I'm not going to go into detail in any of them. So we'll have enough time to talk about possibilities in this line of work moving forward as we think about firearm violence work. The next one, please. Should I? There we go. Thank you. We typically make these acknowledgements, as you know, whenever we teach or give a seminar. These are becoming more and more common. The first one I found on the website of the University of Colorado. And the second one is the one I use in my own teaching and when I speak to an audience. And the hope really is to go beyond making statements, but actually working with communities who are impacted by trauma and have been harmed over decades and centuries. And the work that you all do, and I really appreciate, is that it's very much community-based and community-oriented. So I just wanted to emphasize this as something that hopefully will be our guiding principle. Next one, please. And then, as Amy mentioned, the type of work I will present here today has been funded by a variety of different organizations and institutes, but it doesn't necessarily represent their formal views and opinions. So I was thinking about how to organize my talk, and what I'm going to talk about is chapter 1, observation, chapter 2, introduction, and chapter 3, policy. And I will let you know soon what I mean by those three. The next slide, please. Starting with observation, I'll talk to you about a series of studies that we have done looking at the relationship between antecedents of firearm injury and violence and also the outcomes of firearm injury and violence that essentially have been mainly observational studies. The next slide. I don't know if you are familiar with this or you have seen this article. Back in 2009, this article came up in American Journal of Public Health, Epidemiological Criminology, coming full circle. And the premise of the article was that the paradigm that links methods and statistical models of public health with those of their criminal justice counterparts is needed, as are increased linkages between epidemiological analogies, theories, and models, and the corresponding tools of criminology. Essentially, it was a sort of formal introduction of this term in the literature, but maybe the first epicrim paper that I have found goes back to 1950s or 1960. But this was a more formal introduction of this concept. The next one. And some more recently in the Criminologist, which is a publication by the American Society of Criminology, they have looked at this whole concept of health criminology, and they're documenting an increasing trend in the number of publications that intersect the issues of health and crime. Next slide. This is not a new concept, as you can see in the left-hand side in the top at the Harvard Kennedy School, and the work that NIJ has done. The collaboration and cross-collaboration and integration between criminal legal system and health system is not necessarily something new, but a formal integration of the theories and models is something that people are working on and promoting as an avenue to potentially improve both public health and public safety and public policy. So there is work going on, but I think in terms of formal integration of the two, I think there is still a long way to go. And the question is whether this is going to be helpful in terms of a synergistic impact on improving lives. And next slide, please. And so this paper that I often talk about it with my own mentees and colleagues colleagues at the CDC, Steve Sumner, and others that published some years ago in the American Journal of Preventive Medicine, the work that he did in Delaware, and focused on youth who had perpetrated firearm violence. What Steve Sumner and their team did in Delaware is that they linked data statewide among youth who had committed firearm violence, and they linked that to a whole host of different data sets that you see on the right-hand side, from emergency room data to juvenile services, to educational, to economic, to child welfare. I often say that this is a really good study. We should do the same for suicide as well, but that's something that we could discuss later. You can see this was a case control study. Cases are on top, if you can see, it's a little bit small. Controls are in the bottom of each of these panels. And if you look at the density of those dots as it relates to prior involvement with child welfare system or economic factors in terms of unemployment or educational determinants, you can see the density of the dots is just completely much greater, as you see among cases compared to controls, providing opportunities and insight for prevention of firearm violence perpetration and those sentinel events that happen in the lives of these young people way ahead in advance that we could potentially intervene and change lives. So this is an example of the linkage or integration of data I was talking about. Next, please. Now, moving on, that was the work that Steve Sumner had done. Moving on until the end of my talk, I'm going to talk purely about the studies that we have done. So this was a study that was published in Injury Epidemiology a couple of years ago, where we looked at the city of Seattle and we got all the data on non-fatal firearm injury from our trauma center and linked that data to data from gun violence archives that does have both fatal and non-fatal injury, and you could get data from medical examiner's office as well, and really get a picture of where the shooting and when the shooting happened in the city, such as city of Seattle. Then what we did was to look at this particular index, National Neighborhood Data Archive Disadvantage Index, that, as you see here, using principal component analysis, you can see components of it, and looking at the correlation or association between this index and the rates of firearm injury. This graph shows the count of firearm injury, both fatal and non-fatal, but we also calculated the rate. The reason I'm showing this to you all, because this is such a sophisticated audience, and you all know that the social determinants of health are hugely influential in terms of the rates of firearm injury. But what I'm trying to address here is something more than that, which is, as you see and look at this slide on the left-hand side, yes, there is a positive correlation between deprivation and rates of firearm injury, but that positive correlation, that slope maybe is not as strong as you may have guessed and you may have expected, really highlighting the fact that there are places in the city of Seattle where they are very high in terms of disadvantage, but they don't have really high rates of firearm injury, and vice versa. And so really bringing up questions about what other protective factors or the resilience factor may be operating in those neighborhoods, and some other factors that really may give rise to the picture that you see here. A lot of it was spatially, the variance was very much spatially explained, meaning that some of the adjacent neighborhoods, our census tract, they had some of the similar injury rates to each other. So lots of other factors that may go above and beyond disadvantage to explain some of the differences that you see, even in one city, such as the city of Seattle. The next slide, please. This is another example of a paper that we published in the American Journal of Preventive Medicine, when our focus here was to link data from a Washington State Patrol that has all the data on criminal history among all Washingtonians back starting in 1984, I believe. And so we linked that data to our data from our hospital, Harborview Medical Center, to really get a sense of the events that happen in terms of encounters with the criminal legal system for arrests and convictions, and also substance use diagnosis and mental disorder diagnosis that happen before somebody gets shot. And the point of this project was to really look at GSW, gunshot wound by intent. As you can see here, we also have motor vehicle collision passenger as sort of a control group, if you will. But the point I want to raise here is that when you link data, you get new insight about things that you would not have gained that insight if you had not looked at the data integratively. So, for example, you can see, perhaps not surprisingly, those who had been assaulted with a firearm-related injury assault on the left-hand side, they do have a lot of history of arrest, felony arrest, and misdemeanor arrest in the past. This is an example of a random sample of some of those individuals in each of these groups. Those who had self-inflicted gunshot wound, obviously not many of them make it to, as you know, to a hospital because of the case fatality of the self-inflicted gunshot wound is so large. Many of them have issues such as mental health disorders and substance use disorders. Probably that's not a shock either. But when you look at the legal intervention group, you can see that they really essentially is a combination in terms of the picture of both self-inflicted and assault, in that individuals who were shot by the police, they do have a lot of encounters with the criminal legal system and also with the healthcare system before they were shot by the police. So this type of information will provide you with some insight about tailoring your interventions in such a way that potentially could reduce the risk of some of these injuries, firearm injuries that happen afterwards. This too was a case control study. The next slide, please. So not only can you look at antecedents of firearm injury and violence, but also using the linkage of the data, you could look at the outcomes and consequences of firearm violence and injury or exposure to it. So Fragile Families and Child Wellbeing Study, which I think they just 2 weeks ago, they changed their name from Fragile to Future, has been done by Columbia and Princeton for a long time. Several of you may be familiar with that. It's a really highly cherished, respected study of 5,000 children who were born to mostly unmarried mothers, and they have followed them over time at age 1, 3, 5, 9, 15, and I think more recently in 22. And they have linked folks at Columbia and Princeton, I think Princeton, they have linked the data from Fragile Families to Gun Violence Archive. They have geocoded it. And so you can see actually exactly where the location of the injury was. And then you can link it to this, which is what we did in these 2 papers that are published in Prevention Science and SSM, Social Science and Medicine Population Health. And you can actually look at the impact of exposure to gun violence in those communities, in those neighborhoods, on mental health, depression, physical health, and other outcomes that Fragile Families is collecting. So yet another example of the beauty of integration of data that gives you some insight. Some of them could be the linkage of data geocoding with external data sources to the survey. And so it provides some opportunities about also looking at subpopulations. This is a long study, so I'm happy to answer any questions you have or later when you read it. Differences between boys and girls and many other effect measure modification assessment. The next slide, please. And so you can look at antecedents, you can look at the outcomes of firearm injury or firearm exposure. You can do both. You can link them, you can link them before getting shot, you can link them with the records posteriorly after getting shot. And that's an example of a study that we conducted some years ago that was published in Annals of Internal Medicine, where we linked the records of all people who have been shot and hospitalized in any hospital in Washington state. We linked it to their arrest record and conviction records and hospitalization records and death records to really get a picture for about a decade of the antecedents of firearm injury and then consequence of firearm injury. And what we found was that, for example, the group that had been shot and hospitalized due to gunshot wounds back in 2006 and 2007, they were 21 times more likely to get shot again, compared to like your average patient at the hospital. And so by that, I mean people who had been hospitalized because of, let's say, cancer or cardiovascular disease or pneumonia or other things. And they were also way more likely than other people who had come with other types of injuries, for example, falling from a tree or having a car crash. Those who had been shot, they were dramatically more likely to get shot again, to get murdered, to get arrested, and come back to the healthcare system again, really highlighting the fact that there is something very unique about individuals who get shot in terms of their vulnerability. The next slide, please. And so this is the cumulative incidence function. As many of you are familiar, the top line is the line that's firearm group. So the firearm group, that this is index hospitalization. The group that had been shot, they had come to any hospital in Washington state, they were much more likely to then experience both victimization and perpetration compared to other groups such as non-firearm assault, non-firearm self-inflicted, non-firearm unintentional, and non-intentional. The next slide, please. We followed that with another paper in Annals of Internal Medicine where we looked at the data, the odds of arrest and violent crime both before and after getting shot. Here, our emphasis really was on intent, as I mentioned before. We wanted to compare people who had been shot, but they had been shot through interpersonal violence, and those who had been shot through an accident, quote unquote, or unintentional or negligence. And so we wanted to compare what the likelihood of victimization and perpetration would be if you had been shot through an assault versus it was an accident. Let's say you were cleaning your gun. The next slide, please. And the picture that we saw, which has been so interesting, is this sort of striking picture that you see here that probably you didn't expect before, which is that you link data from healthcare system to criminal legal system data, and you see data like this, which is so interesting, because on the left-hand side, you see patients who have been shot via an assault. So it's an assault-related firearm injury, and then other injuries, and then no injuries. And the y-axis is the incidence of violence-related arrest after they get discharged from the hospital. You can see that individuals who had been hospitalized in the first place because of a gunshot wound, or those who had been hospitalized because of a stab wound or other related mechanisms through an assault, they had a dramatically higher risk of violence-related arrest after they go back to the community compared to people who had not been injured. They had been hospitalized because of cancer, cardiovascular disease, other things. So that's probably not very surprising. The one on the right-hand side, however, it is striking, because why would somebody who has been shot accidentally, quote unquote, why would their risk of involvement in subsequent violence be so much higher than people who had a car crash, who fell from the tree, who cut themselves by accident? Why in the accident group? Why in the unintentional group on the right-hand side? You see that picture. That is somewhat bizarre. And so the question comes up whether this is really because of proximity to firearms? Is that the reason that they are in a cycle of violence, but they were shot accidentally? Or maybe perhaps more likely some of the codes that we use in our hospital system to characterize people that this was an assault or accident are not that great, and they are not that accurate. And somebody says accidental, it's actually not that accidental, and there was actually something more than an accident going on. And so it really led to us thinking about this concept more frequently. And then, recently we were funded with our colleagues at Harvard and Northeastern by National Collaborative on Gun Violence Research to look at the accuracy of some of these coding that we have in our hospital system. And a new paper in JAMA Network Open came out a couple of weeks ago on this, which if you're interested, I'm happy to share with you. That really highlights some of the big problems we had in the epidemiology of non-fatal firearm injury in this country. Huge misclassification. Many people count many of these shootings as accidents, many of them are assaults. And so you see misleading commentaries also in many prominent journals. And you see, for example, 55% of non-fatal firearm injury in the United States accident. That's not correct. That is absolutely not correct. The majority of them are assaults. Next slide, please. So we have been funded by Fund for Safer Future. I know that the first couple of ones were funded by Fund for Safer Future. I know that Chris and colleagues here just received one. The last one was funded by the state of Washington. These are just examples of some of our ongoing projects that we have that utilize this idea of linkages of a variety of different data sources and data systems to understand issues such as subsequent crime after violent misdemeanor convictions, or firearms right restoration after somebody was prohibited from owning or possessing a gun, for example, such as an ERPO or DDPO, and then also implementation aspects of domestic violence protection order, firearm prohibition. So hopefully in the future we have some results that I can share with you. The next slide, we are going to go now talk about intervention. I wanted to talk to you about, next slide, please, a couple of studies that we have done, randomized trials that we have done at Harvard Medical Center and some of our ongoing work. As I mentioned to you, there is this smaller group of individuals who get hospitalized and because of a gunshot wound, and they really constitute a group of people who are at extremely high risk of violence, victimization, and perpetration. So beyond description and observation, which was chapter 1, we should do something about them, which is chapter 2. And so in this study, helping individuals with firearm injury that we called HIFI, we used elements of critical time intervention, which is a really highly respected intervention back in 1970s and 1980s that was rolled out in the city of New York to really help individuals who had mental health issues and they were homeless in terms of transition of care into a stable housing. And so because when somebody gets shot, when they go back to the community, that is a time of transition. We conducted this randomized trial using elements of CTI that you see here. I'm not going to read all of them for you, to really understand what happens to them, and then if they work with a support specialist, does that change their well-being and safety when they go back to the community. The next slide, please. In order to do this study, we linked more than 10 or 11 different types of databases probabilistically and deterministically across healthcare system and criminal legal system to have a better and holistic understanding of what happens to these individuals and their quality of life. So yet again, another example of how to use or harness the power of these data linkages to understand what happens to somebody's life a little bit better. This study was the genesis essentially for what is happening now in terms of our lessons learned. The next slide, please. The work that we are doing with the Office of Firearm Safety and Violence Prevention, I was talking to several colleagues about this morning, and we are now evaluating 7 programs in Washington State that have been funded by the Office of Firearm Safety and Violence Prevention. One of them is an HVIP, Hospital-Based Violence Intervention Program, and the other 6 are community-based violence intervention programs, where they are employing a variety of different tools and mechanisms such as street outreach, conflict mediation, and other aspects, cure violence models, and others, to really improve the lives of young people who are in the cycle of violence. So we just started this work about 4 months ago, and we hope that it will be something that will go for future years. We'll continue with the funds from the office, but we are intervening essentially in a way. It's not a randomized trial, but it's something that we are all as a field trying to brainstorm and understand what are some of the ways that you could evaluate these programs, because the evaluation of these programs is not straightforward, as I'm sure many of you know, especially those of you who are doing it right now, and I know some of you in this room are doing it here in Colorado. Coming up with those metrics to actually define what would be the metric of success. Traditionally in research, we focus on recidivism, quote unquote, focusing on injury and crime and rearrest and rehospitalization, but that kind of domain is a little bit outdated because that actually misses the point, and a lot of good work that these community organizations are doing that may not necessarily translate into a reduction in re-injury or re-arrest, but actually may improve somebody's life. I was just talking to community partners in Washington yesterday, and they were saying that, and last week, and they were thinking about measures of success such as, this young person can now drive, they can now read, they can go down the street in that funeral or get something to eat and they are not getting shot. That is success. Do you have an instrument that can measure that? No, we don't. And also when you have it, the measures or instruments that you have for things like PTSD, depression, and others, they have been validated in other populations that they have no salience or relevance to the population that you're studying here. And so we had in the National Firearm Injury Prevention Conference back in November in DC, many of you were there, we had some amazing abstracts and submission from amazing talent and young investigators that would test and say, well, this cherished instrument that we have been working to measure PTSD or depression and others, I tested among a group of, let's say, young Black men, didn't work out quite well. So it's really important to think about the salience and relevance of our tools, also measurement tools. And so this area is very cutting edge. The entire field in the entire country is struggling with some of these. There's a lot of investment, as you know, by the Biden administration in terms of CBI. So I think it's a time of challenge and also opportunity. The next slide, please. And the last chapter I want to end my talk with is about my work on policy, the work that we have done on policy. I'm particularly interested about this one and very, very excited about this line of work and would love to hear your thoughts and opinions about this. Some years ago, the CDC had a NOFO, Notice of Firearm Funding Opportunity, about, this is now, I think, 5 years ago, about opportunities for investigators to propose a research project looking at just one policy, in relation to multiple forms of violence. This comes from the idea of connecting the dots that some of you are familiar with, the Division of Violence Prevention at the National Center for Injury Prevention and Control at the CDC, where there are many shared risk and protective factors for different types of violence. And so if the lever we're working on, if those risk and protective factors that we are working on, if we could change them, we may be able to change multiple outcomes at the same time. So we sat with our research group and we thought and we brainstormed what would be that policy. And so we ended up with earned income tax credit policy, which I can tell you later why we ended up with that particular policy, and studied earned income tax credit in relation to multiple forms of violence that you see here. Some of them are firearm related. The next one, please. And so just for those of you who may not be familiar with earned income tax credit policy, is one of the largest anti-poverty programs in the United States. It's a massive program, and every year is credited with lifting millions of children out of poverty. Now, as you know, people can be lifted from out of poverty, they can go back to poverty. It's a very time-varying concept. And so it's not as if a child is lifted up from poverty, they go back to it. But it is credited with lifting millions of children out of poverty. And so the shape of the ITC is such that when you look at it, you can't forget it. Essentially, it does have this shape, has a crescendo, there is a plateau, and then goes down. And that's a function of your earning, the number of children that you have, and your marital status. As you can see there, it's a substantial number of dollars that you could get, especially if you have 3 or more children and your income is low and you're married. You can see you could get $5,000 or $6,000, and this is typically a lump sum of money that you come to you, and so you could choose it or choose to spend it however you want. It's not hard we came up with a theory of change. I don't think I have that theory of change here in my slide, we came up with a theory of change that explained by what mechanisms earned income tax credit policy or income support policy may reduce the risk of suicide, may reduce the risk of sexual violence, intimate partner violence, child maltreatment especially. And so you can then appreciate those risk and predictive factors along the pathway, causal pathway. The next one, please. And so this is a laboratory of states in our country, right? We can do causal experimental studies in the United States because we have this laboratory of state policies. Not two policies in two states are the same. And so some states have EITC, some states don't. Some of them are refundable, some of them are non-refundable. Some of them is more generous, some of them are less generous. And so beyond the federal EITC that started in the 1970s, we have state EITCs that began in Rhode Island in 1986. And so states also provide their residents with a fraction of federal to, add more dollars to the program. And so this provides a great opportunity for doing quasi-experimental studies. The next one, please. And so what we did in this project is a UO1, it's a cooperative agreement, which ended last year. We used about 14 different data sets and linked many of them together to really get an understanding of how earned income tax credit policy may reduce the risk of violence. We had studies both at the state level, ecological studies, and also individual level analysis using surveys such as fragile families, National Longitudinal Survey of Youth, and others. When you have individual level data, you can do some analyses that you can't do when you have an ecological state level data. So with the individual level data, you have more maneuvering that you can do analytically and answering some questions that you don't have in a purely ecological study. So we use both state level studies and individual level studies. The next one, please. And so these are just some examples of the papers that we have been able to publish in the past couple of years on earned income tax credit in a variety of different types of violence. Before we started this cooperative agreement, there really wasn't much written in the literature about EITC and violence. There were some studies and some evidence on EITC and maternal and child health, such as birth weight, but there was not much written about violence in relation to earned income tax credit. There were just a couple of papers on pediatric abusive head trauma, but nothing about other forms of violence. So we have been producing this body of evidence that you see here, and some of them are squarely related to firearms, such as the top left-hand side, which we used risk-based behavioral surveillance system to look at weapon carrying and firearm carrying among youth. The one on the top right, John Network Open looks at NOSY to look at criminal convictions among youth, and so it's really has been fascinating to look at the earned income tax credit as a policy and its impact in different forms of violence and the reasons for null findings and also reasons for significant findings, both. It's not as if it reduces all forms of violence. It does work for some, it doesn't work for others, which generates some hypotheses about why. The next one, please. And so we've been able to disseminate and translate some of these work. We were really excited when, in collaboration with colleagues in Washington State Budget and Policy Center, the type of work that we have done has been instrumental in informing what's called in Washington working families tax credit. So Washington didn't have EITC, and so it had on the books, but there's always an asterisk underneath every table of EITC that you see that says Washington has it on the books, but has not been funded. So working families tax credit has now been funded starting this month in Washington. And so we are just so incredibly excited about that translation, about that impact that we talk about when we talk about research. And so I think that's the ultimate goal of everything we're doing, right? That's the destination. So we've been very excited about that. The next slide, please. And so also our work was used by colleagues at Columbia University to inform some of the cost benefit analysis of the child tax credit and other types of credit that were introduced by the Biden administration. If you remember a couple of years ago, there was a proposal by Senator Romney. There was a proposal by the Biden administration during the pandemic in terms of how to provide families with child tax credit. So this research informed cost benefit analysis of that decision for the Biden administration. The next one, please. And so informed by some of the work that we had done on ERTC, just thinking about the importance of social determinants of health and going really upstream, I had a really great conversation with Dr. David Olds right before this talk, and the incredible work that he has done on nurse-family partnership. Informed by that kind of motivation and enthusiasm and value, we took on a scoping review of the literature globally to look at the impact of income support policies on firearm violence. This was the work that we started last year and was published in the special issue of Preventive Medicine on firearm injury, which I know has also papers from this group as well. And so what we found was there were 3 studies in the United States and 1 in Brazil that had looked at the impact of programs that are income support policies program of firearm violence. There were many, many papers out there, especially in domestic violence, that looked at income support policies and domestic violence, but they were not surgically, precisely looking at firearm violence. And I think it's important to look at firearm violence because when you think about the causal pathways that lead to violence, there is sufficient evidence to think that there is something different about firearm violence versus non-firearm violence. And so I often talk about that. I think it's important to disaggregate and partition a little bit and not just stay at violence level. Think about mechanism because means matter, mechanism matters, even ideologically. And of course, in terms of consequences, it's huge, the difference between firearm violence and other types of violence in terms of trauma. You all are expert, I don't need to tell you. So all those 4 studies that we found in our scoping review, first, it shows that the evidence is thin. But second, those studies that did look at it, they really consistently found a positive association between income support policies and reductions in firearm violence. So pretty powerful and important. The next slide, please. And so again, informed by that, we wrote a commentary in JAMA Network Open, really just highlighting the point that income support is a health intervention, period. And you could actually change lives and improve health and well-being by some of these upstream factors. But to me, as I just mentioned in my meeting this morning, to me, this is one hugely neglected area of firearm violence because we work on a variety of different efforts in firearm violence. We rarely go upstream, way upstream, to think about potential impact of that on firearm violence. So we do amazing work in secondary prevention. We do amazing work in tertiary prevention. We do amazing work in healing, which is fabulous, and we should continue to do. But we rarely go upstream. A colleague told me in Washington, D.C., in this National Firearm Injury Conference, after the conference, they told me there were so many fascinating talks. I rarely saw one that went upstream. And so this is a colleague who works on youth development. And so I think that's really important for us to think about because going upstream, thinking about some of these social policies may have a really, really resounding impact and pronounced impact on both public safety, crime, and public health, where we started this talk. As we talk about crime, as we talk about public safety, and we try to understand how it impacts lives, we can't evade the fact that many of the data sources that we use for the analysis of crime, arrest, conviction, and others, comes from criminal legal system. And that's why we have written there as well, is that many of these practices historically in this country have not been necessarily centered on anti-racism or equity. So one big challenge for the field is that whenever we think about using crime data for firearm prohibition, for example, or other factors that we decide, we have to think about that equity lens, an anti-racist lens, and see in what ways we can actually use the data in a way that is informative and it's not harmful. So in our own work, we are trying to be very cautious and very careful whether those projects I mentioned about the future risk of crime, or whenever we use data on arrest and conviction or jail or other incarceration, we are trying to be very careful working with variables such as race, working with variables such as ethnicity, whenever we stratify, why are we stratifying and what does that mean? Is it possible that adjusting for it or stratifying actually will cause more harm? So all of those struggles that the entire field right now is going through, as I'm sure you know, is something for us to really think about very, very deeply and making sure that we continue our commitment to not do harm. The next one, please, which I believe is my last slide. Great, I think timing is perfect. I just wanted to finish with this slide, which the Interdisciplinary Associations of Population Health Science published this paper a couple of years ago. They republished it. This was published, The Political Economy of Illness, published originally in 1975. They found it and they republished it. This is that paper that essentially originally gave rise to this idea of that river that many of you are familiar with. You know, the person was just pulling people out of the river, not paying attention, who was pushing people into the river in the beginning. And that's what public health does, right? That's what public health does, and tries to really go upstream as much as possible. And I think it's through that synergy of working upstream as well as working downstream through secondary and tertiary prevention that I think we can change lives and do something about the reduction of violence. So with that, I am done and would love to entertain your ideas and questions. And the next one. Yeah, so if you have any questions for me, please feel free after I go back to Seattle to send me emails or anything that you would like me to answer that, you know, we may not have time in the next 15 minutes to tackle. Thank you very much.
All right, I'll jump in. I'm never shy. I mean, just such phenomenal work. Thank you for everything you're doing. And I also really appreciated that it is very different from what some of us are doing. And I think it is a sort of refreshing look at the broad ways that people are working on things. I'm curious to know your thoughts on sort of where you see, obviously there's a lot happening in firearm policy right now, nationally with Supreme Court decisions, et cetera, et cetera. How do you see that moving forward with research at the same time? Like, how do we look at these things at the same time that things are changing so quickly? Curious, like what you think these next few years look like, not predicting the political outcomes, but just thinking about how do we in public health and research kind of keep up with it?
That's a great question, Amy. So Bruin has changed a lot of things, as you know, and we both talked about it. The Fifth Circuit struck down the DV prohibition, for example, just a couple of weeks ago. So after Bruin, which I think many of you are familiar with, the landscape, I think, has changed somewhat. I think it has prioritized the importance of historic and text and legal research to identify the analogs, essentially, for the contemporary today's laws and policies. So I think that type of work I can see moving forward is going to gain a lot of importance to create that analog and see what there was precedent for this maybe 100 years ago, 200 years ago. And so, because it's no longer defined by necessarily the contemporary value of a policy, but actually needs to have an analog. And so there's a lot of conversation going on among law scholars and how to interpret that and the impact of Bruin and firearm violence research. So I think that's number one, in that I think legal research, textual research, historic research is going to be incredibly important. Second, the Bruin decision should not be interpreted, in my opinion, as something that rules empiric research out. It doesn't rule out empiric research, but I think it would be really important to conduct empiric research in a way that has that historic connection in mind to be able to be convincing and not be challenged. It does highlight some important questions in terms of the burden on different individuals, including individuals who are gun owners and have the constitutional right to carry. their firearms. And so that type of question, for example, what type of, let's say there is a waiting period, what kind of administrative burden might be of somebody who may want to purchase a firearm? What kind of burden might be on somebody who may want to take their gun to a particular location? It makes the research on sensitive places, for example, really important. So Bruin, in my opinion, doesn't undermine the type of work that we are all doing in terms of empiric research, but it does highlight the importance of how to frame it to make sure that it is following that framing, and also still maintains its contemporary salience. It makes all of us a little bit more, in a way, aware of the history, maybe, and thinking about the past and how we can make that connection to the now, to the present time, because of the particular way that it was interpreted. But I think it's an exciting time for us post-Bruin to see how we can do just that.
It's a very quiet bunch, so I'm going to ask on behalf of the many students and trainees who are in the room and listening in. Do you have thoughts on guidance for them getting into this field and starting their careers, and sort of where you see opportunities?
Oh, I do. I can talk about that for a few hours.
I know you love teaching.
About teaching, yes. Yes, so my career trajectory is anything but linear. You know, I was born in Iran. I came here in 2003 to get my MPH at Yale, and I started working on infectious diseases. And so I had done my medical school dissertation on bloodborne infections, hepatitis B, hepatitis C, and HTLV1 on incarcerated injection drug users in prison in Mashhad, northeastern Iran, which is very close to Afghanistan. And so that was my medical school dissertation. I continued my work on infectious diseases and vaccinology through my PhD and my postdoc. And then, you know, when I started my position at the University of Washington in September of 2012, I started teaching just about 7 or 8 weeks after that Sandy Hook happened on December 14th, 2012. And that changed, you know, my life. That changed the lives of many other people. Many grassroots organizations were born, as you all know. And so since that day, I've been working on firearm violence, which does sound like a change, obviously, in terms of career trajectory. But we were really convinced by the importance of the question, by the urgency of the question at that time. And also I was very, very fortunate to be obviously mentored by giants of the field, particularly Dr. Rahhani-Rahbar. So for the mentees, for the students in this room, having, you know, a phenomenal mentor is, you know, I can't emphasize that enough in terms of making those connections. I remember Fred one day sent an email to literally 50, 60 people around the country introducing me, and, you know, the rest is history. So that's a mentor, right? That's a mentor where he or she or they can do that for you. And that's the power of having a great mentor. And so you're very lucky to have great mentors here in this room. I know they do just that. The times have changed. You know, now I'm obviously much more established than when I started, but at that time there really wasn't much funding. It was essentially Joyce Foundation, state of Washington and state of Seattle stepped up to the plate. They saved about $153,000 to be exact. We can give you $153,000 for gun violence research. We use that money, and then things have changed. You know, now NIH has funding, NIJ has funding. NIJ has always had funding, but has been more criminological perspective. But NIH, CDC, some more foundations, you know, NCGBR. This group has been so successful in securing funding from all of those, so I don't need to share with you. But the times really have changed drastically in terms of funding availability. With the same kind of logic and reasoning, also they may not last forever. And so the question would be that if you are in this field, the reality is that what is your driver? What motivates you, and what are your values? If things get tough, let's say 5 years down the road, 10 years down the road, and the funding that we are enjoying right now vanishes, now what? Do we go back to what some mentors used to say back in 2000s that no, don't get involved in this. This is a tricky one, or no, you still are committed to continue that line of work. And based on the new generation and young scholars I see, I think the answer is that they're going to continue this type of work. I don't think we're going to go back. I don't think we're going to go back to the era where people were discouraging young people from getting involved, because I see enough motivation, enough movement, enough momentum. Then I think it's going to be very difficult to go back to those difficult years, and I think the momentum will continue, and this new generation will push that through.
Sorry. I am particularly compelled by your statements around upstream prevention on this too. It is my love related to firearm injury prevention specifically, but I just wonder if you can talk more about how you see the field going in that direction. There's even funding sources at this point in time that are starting to pop up a little bit, but what we can do better to really move firearm injury prevention research in that direction.
Great question, Kelly. So I think the first thing that we can do, that I'm trying to do on a personal level, is to publish more on it. Because when you publish on it, you put it on the map. So, like for example, right now I have a paper that I can talk about it. It's under review. I'm exceedingly excited about it because it's exactly upstream on firearm related harm. And so like, if that comes out, I will feel very good, because I think it's another tool where I can take it to a policymaker or community leader and say, look, we have provided evidence that this works. We had a really great conversation this morning with Dr. Oles, is that the challenge with going way upstream is that the ideologically relevant window of time becomes so long that people may not buy the notion that if you change somebody's life when they were born or when they were a baby, you're not gonna shoot somebody, or they're not gonna be shot when they are a teenager, right? So ideologically relevant period of time becomes so long that is much harder to articulate, as opposed to an intervention that's happening now when they are 16 years old. And so for that to happen, we need more papers and more empiric evidence that shows those interventions may work, and more evidence that shows some of those early interventions and upstream interventions may impact risk and protective factors that are well-established risk and protective factors for gun violence, for firearm injury. Because some of them are well-established in terms of the connection, the second part of the mediation, the relation between risk and protective factors and firearm injury. That has been established. The first part of mediation comes from the impact of those upstream programs on those risk and protective factors, and then you have the full mediation, right? And so I think my first reaction is that we don't have nearly enough papers and presentations and evidence. As it relates to firearm violence, I'm saying there's plenty on child maltreatment. There's plenty on other types of, I'm talking about firearm injury here. We don't have nearly enough papers that look at that. So that collection of evidence then, once you produce that, provides an opportunity then to obviously write grants and more proposals based on that evidence to do innovative work. And I think once we accomplish that, and we write those proposals to look at those, we're going to need to do a couple of things. One is to quantify the impact of those upstream factors on the outcome. If it's a null relationship, if it's not significantly associated with outcome, really do an assessment of the causal pathways to see where it may be broken, because that's equally valuable, in my opinion. Like negative studies, it's called the negative studies, are, if they're well done and they are precise, point estimates, supremely valuable. And so that's number one. Number two, which I think is also equally important, if there is an association between upstream interventions and reduction of firearm-related harm, effect measure modification assessment, among whom, in which subpopulation they may be particularly beneficial, because that's what the policymakers care about. They want to know where the money should go. Is this universal, should go to everyone? I don't have all the money for that, but there are a particular group that may benefit from this. in a stronger way. And thirdly, which is the most sophisticated and analytically exciting but very difficult, is the interaction between the policy itself and other types of policies. So interaction between social programs and gun policies, because these policies don't happen in isolation. It's not like, okay, in Colorado, we just have one policy. There are hundreds of thousands of policies. How did they work together in terms of synergy and potentiation and antagonism that may blunt or promote each other's impact? That kind of analysis of systems thinking is sorely lacking in the literature right now. So those three things come to my mind in answer to your question.
I think we have time for one more question. Anyone? I'll ask one. No, the chat is quiet.
Well, I don't, yeah, maybe, I don't know if this is fast or not, but, I'm intrigued, it's not well formed either. I'm intrigued by the intersection with criminology and criminal justice, and it strikes me, there's silos everywhere, but is this one particular one we might need to try harder to break down, and maybe you could just comment on your interaction with colleagues in that area, or your sense of that, because I wonder if they're speaking a language that is more compelling to policymakers than we are sometimes, and if we could. And is that discipline also looking more and more upstream, as I think public health is, and just, commenting on those.
Yeah. Oh, I can talk about that for a long time, but I'm going to talk about it for 60 seconds. Absolutely. I think there are things we can learn from that discipline as well. So, for example, public health is a very empiric field, as you know. They have a lot more theory, as you know. I think we can learn about, stronger public health and epidemiological theory from the work that they do. They historically have not really looked at upstream factors much either. So that is a big gap in that literature, in that field as well. But they are increasingly looking at that. On a practical note, some of the things that the field of criminology can benefit from public health also are really valuable, and that only comes through conversations with them. So, for example, there are very specific studies of crime and homicides and assault, employing the exact principles of outbreak investigations for cluster analysis that we do in public health department. There are a couple of really neat papers in JAMA I can share with you. And so on a very practical level, the tools and methodologies of public health have been very helpful in terms of shedding light on some of the criminological work. So I do think that dialogue is really, really important to continue to have, and especially in this time of social justice and racial justice reckoning, that is even more important than in the past. And that sort of equity lens is going to be really, really important in those conversations. So I'm optimistic that kind of cross-field cross-discipline dialogue would potentially have an impact that we may not benefit from just one of them on its own, but needs to be done with a lot of care and delicacy.
Hey, well, I think we're at time. So I want to thank everyone who joined online, as well as all the folks who joined in person. This was recorded, and I think the recording will be up on our YouTube channel for folks who want to revisit it. I want to go back and rewatch it because I learned a ton today. So thank you so much for coming in person to visit with us today. Thank you to everyone for joining, and we hope to see you next month when we're talking about child passenger safety.
Thank you.